morning, Bespoke Babes. It's Dr. Kim. So this morning, I want to talk to you about something that's not at all cosmetic, but is important skin information. And that is the ABCDEs of suspicious moles. So not so long ago, I had a client come in for a cosmetic consult looking to have sunspots removed. And they'd been to a couple different places looking for ideas and was pretty well versed on the options of IPL and chemical peel and was looking for some other options. When I examined this client, there were some features of the sunspots that were incredibly concerning for an actual skin cancer, not just a cosmetically unappealing sunspot, essentially. So before jumping in and just recommending cosmetic treatments like IPL or chemical peels or even lasering, I completed a biopsy and confirmed the diagnosis of melanoma. And melanoma is a potentially fatal form of skin cancer. So it's really, really important to understand what the signs of melanoma are or suspicious concerning moles are, because not all sunspots are just sunspots that we can take off cosmetically. Sometimes we do actually need to go in and treat them medically. So what are our signs? So it's easy to remember as the ABCDEs. So A for asymmetry, B for border, C for color, D for diameter, and E for evolution. So asymmetry, any mole that you have, you should be able to find a mirror image within it. You should be able to kind of cut it right down the middle and see that it is symmetric. If it is changing on one side and you cannot find symmetry in it, it's a weird shape, that's concerning and we need to check it out. B is for borders. So you should be able to look at your mole, look at your sunspot and see very distinct border to it. If we start to see that those edges are kind of blurred, it's hard to tell, where does it start, where does it stop? Again, very concerning. So you can see asymmetry, you can see weird borders here. C is for color. We should have one normal brown color, one distinct brown color within that sunspot. We should not be seeing speckling, different colors. If you are noticing a change of color, maybe the whole thing is getting darker, this is concerning and it needs to be checked out. So here in this picture, you can see the change of color in that mole. D is for diameter. So benign, non-concerning spots are less than about 6 millimeters. So that is the end of a pencil. So if you put a pencil eraser down and it's covering your entire spot, that's reassuring. If it's growing beyond that, that is concerning. And then E is evolution, so changing color, changing size, changing shape. Sometimes they actually start to open up and bleed, they don't heal. Any of those signs, we are concerned about them. So ABCDEs, these are really important to understand. And you can see those pictures there of suspicious moles. Not all sunspots are just sunspots that we can remove cosmetically. So if you have a spot, you don't like the way it looks, it's very, very, very important that before you commit to having a cosmetic procedure done, you have an appropriate medical evaluation of your spot to make sure that it is not cancer and going to cause you trouble down the road. So ABCDEs of suspicious moles. Please wear your sunscreen. Okay, have a great day, Bespoke Babes.